So one of the things that we are on high alert for is contrast-induced nephropathy. So anytime we are dealing with IV contrast, this is something we are trying to prevent. Contrast or IV contrast is nephrotoxic, okay? And it causes a contrast-induced nephropathy. So what you'll see here is you'll see a decline in renal function as evidenced by a rise in that serum creatinine. So your patients that are most at risk for this are patients with azotemia, or they have, circulating waste products, patients with diabetes associated with renal impairment. So elderly patients or any patients with any type of renal insufficiency type issues, high risk for contrast-induced nephropathy. And so before we can give IV contrast to a lot of these patients, we're going to get a creatinine level back. And if it's elevated, we're going to treat it before we give them contrast, because we certainly don't want to shut down a patient's kidneys from IV contrast. So radiologic studies that you're commonly going to see, so one of the things that you're going to see is something called a KUB, or a kidneys, ureter, bladder, okay? This is a radiographic study that is used for the urinary system. It consists of a plain, contrast-free X-ray that shows kidney size, position, and structure, as well as any renal calculi or any other lesions. A lot of times they'll use this to determine where the kidneys are placed. But for diagnostic purposes, it actually provides very limited information. So basically, this is a pretty simple one. You inform the patient that there's no need to restrict food or fluids before the test, and there's no specific post-test care that's going to be necessary. The Pilogram, on the other hand, the Pilogram is utilized for a lot of different things. Pilogram is an image of the renal pelvis and the ureter, and you can do this a couple different ways. You can do intravenously, which is going to be the most common, where you inject contrast into the IV, and then you'll have serial x-rays that show the contrast as it's cleared from the blood by the kidneys. Retrograde means that they introduce the contrast through the ureter. Antegrade, the contrast is done by a percutaneous needle puncture into the renal pelvis. So pilograms are most commonly going to be IV contrast through an IV, but there are other methods that they can use to accomplish this test as well. The intravenous pilogram, this is the IV contrast is injected into the IV site, and the contrast media is going to outline your renal structures. Again, before you give this patient the dye, you want to make sure you check allergies, and we're going to hydrate the patient before and after. Hydration before, especially if we're dealing with an elderly patient that may have contrast-induced nephropathy, and we hydrate the patient afterwards so that we can clear the contrast from their body. This is a picture of an IV pilogram, so you can kind of see where the dye is up in the upper extremities. And like I said, they'll take a series of pictures here, and they'll trace the dye throughout the entire renal system. Other things that you might see, renal angiography, for example. This is going to allow radiographic examination of the renal vasculature after injection of a contrast. It can be, basically we're using this dye to visualize the renal arteries. You want to make sure you check the patient's sensitivity to contrast, also to iodine-containing foods like shellfish. You want to instruct the patient to fast for about 8 hours before the test and drink extra fluids the day before and after the test to maintain adequate hydration. And we're going to keep the patient flat in bed after the procedure. Because they're going to go in on one side, you want to keep the leg of the affected side straight for at least 6 hours or as ordered. And then again, we're going to routinely check creatinine levels to see how our patient's tolerating it. Endoscopic procedures, you've got cystoscopy and pyelograms. For the cystoscopy, this is where they take a cystoscope that's inserted into the bladder through the urethra. There's also retrograde pyelograms where contrast media is injected into the kidneys and the pelvis, and then x-rays are taken. There's also renal ultrasounds. Ultrasonography, this is where they use high frequency sound waves to reveal internal structures. The pulse echo transmission is going to determine the kidney's size, the shape, and position. It can also reveal internal structures and perirenal tissue and helps the doctor diagnose complications, especially after kidney transplant. If we're doing, the ultrasound, you want to tell the patient they'll either be prone or supine during the test. And you want to explain that there will be a water-based conductive gel on their skin, and then they'll feel the probe or the transducer against the skin as it moves across the area being tested. The renal ultrasound is great for showing kidney enlargement, kidney stones, chronic infection, and tumors. The other thing I like about it, there's no dye utilized here, so you don't have to worry about contrast-induced nephropathy, and there's no prep work for this as well. Renal biopsy, on the other hand, this is where they're going to do a percutaneous or small incision into the renal itself, or the kidney itself. Pre-op care for this, you want to make sure the patient is NPO. They will also get a mild sedative. You want to instruct the patient for NPO that they should be NPO at least 8 hours before the procedure. The mild sedative that they get will help them relax. After the test, you want to tell the patient that pressure needs to be applied to the biopsy site to stop any superficial bleeding, and then a pressure dressing will be applied. Remember, the kidneys are very, very vascular. You want to instruct the patient to lie flat on their back without moving for at least 12 hours to prevent bleeding, and you want to tell the patient to avoid any strenuous activity for at least 2 weeks. Diagnostic test nursing diagnoses, anxiety, acute pain, altered urinary elimination, deficient knowledge, all excellent diagnoses for any of the diagnostic tests.